I love being a practice nurse. I think that it's, very empowering for the clients and for myself as well, and for the practice as a whole. So I think it's a wonderful area of nursing to go into. Setting up any sorts of nurse-run clinics within any practice is a lot of work, but it's the outcomes for the clients are, so important.
Basically, you've got to start off with what you want to achieve. So if we were looking at diabetics or diabetes patients, you've got to actually find how many diabetic patients you have in your practice. You've got to do lots and lots and lots of data quality control, data entry, and a lot of practices aren't even familiar with their own medical software. So the local divisions help with that you can ring up your division and say, can you send someone out to show me how to use Medical Director or ZMed or whatever. Initially when I started at this practice, we had something like 15,000 on our database. After culling, cleaning up, whatever you want to call it, archiving, I can now say we've got 8,700 patients and 350 diabetics, and I can tell you that's perfect.
When we've got clients coming to us, obviously we do some education within the time that they're with us, and of course that's an ongoing thing when they come back for their review. So some of them will actually say, well, can I come back every 3 months, because it's nice to have someone in the background giving us a hand. So we also refer them off to our specialist allied health practitioners to make sure that they are getting that really specific education that they need. So incorporating diabetic educators and dietitians, all those sorts of things, ophthalmologists, podiatrists. So we get them all involved. We get a really good, strong support network around them to make sure that they can continue with their preventative health.
We were asked to write down what we do, and we were chosen from practices all over Australia to host a visit from practice in Tasmania, and that's just happened last week. And they came over, and for 2 days we just basically sat down and talked about what we're doing at our practice and how they could implement change in their practice.
We get help with all that sort of information from general practice divisions. They always give us help, send out newsletters. The Practice Nurse Association that both of us have recently become members of, they're a really good source of information. And then we've also got information coming through from the doctors, so they will get different sorts of information that they're always really good at feeding back to us.
If someone was wanting to upskill or improve their ongoing education, the divisions, local divisions are great.
As you work through anything and you're setting up any sort of clinic, if you find that you're struggling a bit and you're sitting there thinking, oh, I've asked this question a million times, I'm not going to ask it again, I'll just kind of brush it under the table. My philosophy in life's always been better to look stupid for asking than look stupid for not. So if that's the case, just keep going, because the answer's out there. It's sometimes just a matter of finding the person with the right answer.